Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
Hey everyone, today we're going to talk about Pramigel, a medicine that combines aluminum hydroxide, magnesium hydroxide, metoclopramide, and simethicone. Let's see what it's for and how to take it. Pramigel is often used to relieve heartburn, reflux, and bloating. If you've ever felt a burning sensation in your chest after eating, this medicine can help you feel better. It also relieves indigestion and excess gas. Are you wondering how Pramigel works? Well, the aluminum hydroxide and magnesium hydroxide neutralize stomach acid. Metoclopramide helps your stomach empty faster, and simethicone reduces gas so you feel relieved right away. To take Pramigel correctly, it's very important that you follow your doctor's instructions. Depending on your condition and how you respond to treatment, the dose may vary. It is usually taken 1 or 2 tablespoons before meals and before going to bed. Remember that, like any medicine, Pramigel can have side effects. Some of the most common are headaches, dizziness, and diarrhea. If you have serious reactions, such as difficulty breathing, tell your doctor immediately. Do not take Pramigel if you are allergic to any of its ingredients or if you have certain medical conditions. It is best to talk to your doctor before starting any treatment. In short, Pramigel can be very helpful in relieving heartburn and stomach discomfort. Follow your doctor's instructions and pay attention to possible side effects. Take care. Thanks for watching this video. If you have any questions, leave them in the comments below. And don't forget to subscribe for more health tips. See you soon.
If you've made it this far, let us know in the comments why you're using this medicine.